We postponed all of our elective surgeries due to the governor's executive order and to help conserve our personal protective equipment and to maintain social distancing. For the last 6 weeks, we have had surgical cases performed here at Riverside Doctors Hospital. We have not stopped our OR. We have our OR services are here in the building ready to serve our patients if needed for emergent cases. We've performed over 250 cases in the last 6 weeks, primarily general surgery, orthopedics, and urology. We have continued to care for our stroke patients and chest pain with concern to make sure someone's not having a heart attack. Our volumes are down. And that's concerning because we do want patients that are having stroke-like symptoms to come to the ER. We can safely care for them in a safe area, maintaining the social distancing and all of the infection control measures that are required. We're taking extra precautions to keep our hospital clean. Our staff is continuously and frequently wiping down their workspace areas. We have environmental services doing lots of cleaning in the open public spaces, wiping down areas that come in high contact with people, their hands, door handles, side rails, etc. All kind of cases that we're scheduling right now are outpatient surgeries, patients that will not require to be admitted to the hospital overnight. So these are low-risk patients that are going to be able to come in and leave the same day. The decision for the patients who come in and qualify for this type of surgery, it's a form that's recommended by the American College of Surgeons, and all of our surgeons are completing that to determine what type of patients qualify to come back for elective surgery. You're going to be screened by our pre-op nurses, anesthesia, your surgeon that day to ensure you're not having any medical problems or issues that could impact, your surgery for that day. So whether it's infectious disease or you're short of breath or there's other medical concerns that you're having right then that may be a concern to anesthesia or the general surgeon. If the patient needs additional lab work based on their medical condition or what's required for their surgery, the physician can reorder those lab tests as an outpatient, and the patient can get a message and then proceed to the hospital or to the diagnostic center to have outpatient lab work. At Doctors Hospital, as a patient, you will see that all of our staff is screened as well daily with the temperature check, and they will be wearing a mask while in the facility as well. Our current visitation is that there'll be no visitors allowed in the hospital. We will make arrangements. Their family members can wait outside in the parking lot in their vehicle. We will get appropriate phone numbers so that our staff can communicate with them, updates, progress, or when that individual patient is ready to go home. So these patients who are outpatient after their surgery will be able to communicate with their surgeon or his or her staff through MyChart, which is the Riverside electronic medical record, that allow them to give updates on their condition, how they're healing. They can ask additional post-operative questions. After the patient has had their surgery, if they need prescriptions, the physician will be able to e-prescribe it to their pharmacy of choice through eye care.